the Penn team did a really great job, because sometimes pilot studies are like 5 or 10 animals. They really took a big step here to go up to 40, because that's starting to get a lot of data here.
Hello, everybody. I am here today with Dr. Brunke, who is a sports medicine and rehabilitation specialist. He is here to share some of his knowledge. He actually is a 2004 graduate of Ross University of Veterinary Medicine in St. Kitts, and he received his certification in rehabilitation in 2008 from the University of Tennessee. And back in 2018, he became board certified in veterinary sports medicine and rehab. So he knows a lot. He's got a lot of letters after his name. And he's here to actually weigh in on the pilot study that was done by UPenn on the big Barker beds. So welcome, Dr. Brunke. We're so happy to have you.
Hey, Dr. Wooten, it's nice to be here, or there, or all the places we all are right now.
Before we just get into the study, I just would like for you to share with viewers what you do.
Right, because that's what's a sports medicine specialist in small animal veterinary medicine, right? I don't deal with humans that are walking weird. I don't deal with horses that are walking oddly. Everything else is what I deal with. So I have an amazing team. I'm in Northern Virginia at Veterinary Surgical Center's rehabilitation. I'm lucky enough to work with a fantastic team of other doctors and technicians and certified in rehab and VTSs in rehab. So we're a SWAT team that looks at things and goes, if it doesn't walk right, how do we make it walk better? And what's wrong? Most of my days spent as a diagnostician. Is it an orthopedic problem? Is it neurologic? Is it both? I also still like to work a ton on preventative medicine. So even though I've left the kind of the primary care world, I still am a huge proponent of preventative medicine. And that's dealing with keeping animals fit and healthy, keeping our military working dogs fit and healthy and doing their jobs, our working canines. So we still do a lot of healthy conditioning work in keeping dogs ready for combat duty, ready to do their daily jobs of helping people get around in communities. But we also take things that have just had problems, whether it's they're not recovering as well from a recent surgery, they're battling cancer, we're in a hospice situation, whatever it is that doesn't walk right. That's why my team and I are here, and I'm lucky to be a part of it.
So do you do any work with helping dogs have less pain in conjunction with osteoarthritis?
Absolutely. So arthritis management is a huge part of my practice. We have to figure all those things out, because short of a joint replacement surgery, we don't cure arthritis, we manage it. So management may be through oral medications, joint supplements, diet. I do a lot of joint injections, things like synthetic joint fluid. We get into platelet-rich plasma and stem cell therapy. We even get into now, there's some new stuff coming down the pipeline that we're adding to our practice here, in that it's injectable radiation therapy for arthritis. That's been showing 12-month or more improvement from single injections. So we're always looking at ways to be extremely safe, to extend both the quantity and the quality of our patients, because that's what we're all here for.
Absolutely. So in that same vein, obviously we are looking at this study on potentially another tool in the toolbox that pet parents and veterinarians could possibly use to help improve the quality of life of dogs that have osteoarthritis. And so you read through the study, correct?
Yep.
So I would love to know, an expert such as yourself, what are the first impressions that you got from this pilot study?
Well, I'll even back it up a second as to why this was really important to do, okay? Is because if you think about it, when I, as a specialist or any part of the veterinary team, sees your pet, we may work with them in rehab, but we work with them for what, maybe an hour, twice a week? So where are all those other 99% of the day spent, right? Pet parents and their fur kids, the pet parents are the caregivers. So you guys, it's that home environment that's really important, whether that's home exercises, getting out and walking safely every day, getting some light exercise and stuff done. But it's that home environment of how they get around. That's where they live in. So it's such an important factor. There's as much work as me and my team can do. It has to be that team approach that also goes back to the parents. Mm-hmm. So setting up something that can help improve that home environment was really important. So when I took a look at this study, I said, all right, now here's some data that where do dogs want to sleep? Do they want to seek this out? Do they want to be comfortable? And can it be something that's positive for them? Mm-hmm. So that my initial thought was, this could be a good thing if it can help us to modify that home environment. And from the data, it looks like there's a good start here.
So as far as the results that Grace Mendel and her team got on this particular study, was there anything that stood out to you?
There's a couple here. And it's always great with pilot studies because you have a focus group here, and the Penn team did a really great job, because sometimes pilot studies are like 5 or 10 animals. They really took a big step here to go up to 40, because that's starting to get a lot of data here. And when I looked at that, I said, okay, we want to find both owner feedback and then we want to find some objectivity. And what I really liked about this was they went for as much as they could get of both. And so from the object stuff, they said, especially with our nonverbal patients, they said, well, let's put activity monitors on them and see if they sleep a little bit better. Because we know with arthritis, if your back hurts, even as us, right? If you're not comfortable at night, then you're not going to sleep well. You're going to toss, you're going to turn, you're going to get up. So usually the good thing is if you're out cold, you feel great the next morning. And that was one of the things from the activity monitors, was that it started to show that there could be a trend here in that they're going to just not get up as much at night. Mm-hmm. So that was really important to me. And it was the simple fact that the pets sought out the bed. Because think about this. How many times do we get a big, nice, fancy bed, we get something for them, and your dog goes, kitchen floor, out cold. That's their favorite spot. So when dogs seek it out, that's also one to me they're telling us that this is comfortable for them. On the subjective side, I think we had some pretty good feedback on the pain scales and how the dogs were being able to move around a little bit better the next day. So that we have to start to look at a little bit more. But it looked like there was some positive results here.
And so when you're looking at this study as an expert, what additional questions do you have as somebody who's evaluating new tools to use to help these dogs have a better quality of life? What are additional questions and data points that you would like to see so that you feel really confident that this is another part of the multimodal approach to osteoarthritis, the therapeutic bed?
Right. So when I look at that, I said, okay, as we always say in vet med, further studies are needed. So let's go out. If we can get 40 dogs, let's go out and get more dogs and look at that. That's always my first part, is let's repeat it. Let's keep expanding it. And then also, can we compare it to something else? So what would be a fun one to look at is if we could have, how are these dogs sleeping the 60 days before the study started? Where were they sleeping? And so not only throughout the study did they sleep better, that's what Dr. Mengel looked at in this, but how are these dogs sleeping before? Were they getting up 2, 3, 4 times a night? And now they're not getting up at all? So extending it, having a little bit of a crossover with a negative control would be something I would want to see a bit. And then remember, like you said, it's that multimodal approach. So this is not going to be a one-stop shop of fixing everything, but if it helps them to get to a point of being comfortable, that really is important, because a good night's sleep, we all know we need one.
So with the results that you looked at and the data that you saw from this study, did you see enough positive results that you think that this subject does warrant further study on the benefit of a therapeutic mattress on these big dogs that have arthritis?
Absolutely. Yeah, there's enough data here. If you'd shown me this data from like 4 dogs, I'd go, we don't know enough here. But off of a 40-dog pilot study, now what you want to just try to see is can we get this even longer? Like, I would love to go back and look at this over 3 months or 6 months, that's hard sometimes because as researchers, we only like to change one variable in the equation at a time. And I know I emphasize with my pet parents that if we're managing arthritis, I'm putting in short-term, medium-term, and long-term goals. And a lot of my medium and long-term goals may be something that would be hard to understand. Did the bed continue to make that difference? So I think it's important we only change one variable at a time. I always focus too that they need to be comfortable, but we also know that they need to be lean. So if you have an osteoarthritic dog or cat, the more mass they carry, the more stress it is on their joints. And there was actually a recent study that looked at a huge number of dogs and understanding that if they were overweight versus just being an ideal body condition, that basically what it boiled down to was fat dogs live less. Like Chihuahuas and Dachshunds in this study lived on average 2.5 years less than their lean counterparts. And our big dogs anywhere from 6 to 12 months on average. So I like to look at that multimodal approach, which sometimes makes the researcher in me twitch a little bit.
And can you just define multimodal for our audience, please?
Oh, that's a huge one. Right. So we look at multimodal on both a tiny level, a zoomed in level, and a broad spectrum. So multimodal approach means that, let's look at it in the big spectrum, is we work as a team. So an osteoarthritis patient has parents, has a primary care who's helping to diagnose it and manage their overall health, may have a surgeon who gets involved in, maybe it's a hip replacement surgery or a arthroscopy to clean that out, and then has a rehab doctor and team to then carry that forward over the next 3 months or year to achieve their goal. So that's working as a big team. In those pieces, that's things like, do we take certain pain medications? Do we eat a prescription diet? What's our home modifications? And the big Barker bed, from this data, looks like it would be a good home modification for my arthritic patients. It's a way to attack from multiple fronts on a disease, because there's not one simple one-stop shop solving here.
So do you think, Dr. Brunke, as the expert that you are, if you have some of your clients coming to you and asking about modifying the home environment for their arthritic dogs, do you think the results of this study warrant recommending a therapeutic mattress as part of a multimodal approach to helping these dogs with arthritis?
Yeah, I think it does. What I would want to ask them is where does your dog like to sleep ahead of time? Do you want your dog up in bed with you? What type of mattress are you currently sleeping on yourself even? And think about it, because if you set parameters with your pet and they are the ones that have for years and years and years have always slept on the cold stone floor because that's what they're comfortable with, that's what their constitution kind of tells them to sleep. Yeah, but maybe at least with that, get better traction for them to get up. Simple home modifications can be making sure that our arthritic patients have their nails are trimmed down, because if they're overgrown, they can't get, their feet are out of balance. But if they have a lot of fur on the bottoms of their feet, that we shave those on a regular basis so that their toe pads and foot pads are exposed to get them traction. But if they like to try to lay on things, but they used to let them lay on the couch, but now they really just can't get up on the couch, or they used to be able to jump into that high bed with you and now they can't, well, they know that they like something supportive, then getting a bed involved with that would be really good. So I look for, we always say that our dogs do talk to us, we just have to learn how to listen. So watch them and see where they like to be and try it. That's the thing about this is, what do? When we go to a new hotel room, we jump into a bed and we go, okay, how good is this bed or not? How good is this mattress? Or if we go mattress shopping for ourselves, this is something we spend a third of our life doing, is sleeping. So if our pets are doing that too, they should find something that's comfortable for them. And that's a good aspect to help modify the home. It's a third of their lifetime doing it.
Well, this is awesome. I have really appreciated you sharing your opinion and your thoughts on research, and appreciate everything that you do for pets. And I'm just really grateful that you came to spend some time with us today.
Well, thanks for having me, Dr. Wooten. Like I said, it's always that multimodal approach. We learn better by communicating, and if we can't hang out in person, then we still find ways to get together because we're all always here for the oath that we took when we graduated. We want to help everybody out, make things as best as we can.
Yes, sir. Yes, absolutely. The oath we took, above all, do no harm, right?
Yeah, absolutely.